Good evening, everyone. Today, I am going to speak a short video on World Disability Day. World Disability Day, I just wanted to give a few message on two important things. One is invisible disability, and another is visible disability. So there are ample of examples in invisible disability. Among them, I am going to speak about fibromyalgia. It is a condition which is generalized. People used to think that a lot of myths in fibromyalgia, thinking about it is some sort of a muscular or a neck pain like. But this is not true. It is not a myalgic pain. Overall body pain with fatigue in the sense severe tiredness, stress, lot of things which happens, and not only that, even they may have urinary incontinence, other issues. So it may lead to a chronic pain and chronic disability. It's a crippling disability. Nobody knows that, but people will be physically good, but their ability, their performance, psychologically they will be affected with lot of systemic problems. So there are a lot of peoples who has been in and around the world struggling with this chronic problem, and they used to consult a lot of physician, psychiatrist, rheumatologist, and different specialists, and again they will try and alternate therapies, like the siddha, ayurveda, homeopathy, massage, whatnot, different type of things, and even different type of manual things, physiotherapy, chiropractic, osteopathy, massage, and different things. So these type of a thing which happens very commonly in the fibromyalgia. So what is the main thing? It is a whole pain alarming system which is happens mainly in parietal and frontal lobes of the brain, central nervous system disorder. So pain alarming systems which has been amplifies more. Why this is happens? The cause is unknown until now, not yet diagnosed, but it may be due to life stress events, past childhood stress events like any trauma or anything which is happens crisis in their life, which may be affected. For example, car accident or something like that, or suicidal incidents, or some sort of a crisis which happens in the life, which may affect in particular decade of the life. So that is fibromyalgia. So these type of a patient definitely, which is shrink and keep ideal in the home, not participating in any social or not going to any jobs. So a lot of absenteeism in their life. So we have to identify such a patients, and we have to screen them with central sensitization, because this problem is central sensitization problem. So we have to screen them with a questionnaire, find out whether they belong to mild, moderate, severe category, and according to that, we have to plan a treatment with multidimensional factors like psychologist, yoga therapist, physiotherapist, and physician, orthopedician, a group of people's neurologist, a lot of people's, even a physiatrist, or a group of people's can be need this enrollment of treatment for this patient. So by this, definitely we can improve the recovery. The patient not able to be cured fully. So there is no cure for fibromyalgia, even though a lot of medicines, upcoming medicines are coming out, but we can able to manage by doing good exercises, very graded pacing of exercises, good yoga, and good meditations, mindfulness meditations, all those things which helps to able to cope up with this chronic pain, manage the symptoms, and they can lead a normal life. And another important thing, that very simple issue in the amputation patients, the part of a limb which has been taken off, chopped off because of the diabetes or any accidents, person lost the vascularity in the limb, so they'll go for amputation. So they need mainly some sort of a patient will have a chronic pain called phantom limb pain. The stump which is having a pain that is happens due to the brain symptoms. It's a higher cortical representation, somatosensory cortex in the brain. The brain which mimic that some sort of a limb which is part of a limb chopped up, still it is present and there is a itching or a pain will be there. So we have to fool the brain. How the fooling of the brain occurs? By physiotherapy and medications. The people who are treating, the doctors who are treating, physicians or physiatrists or orthopedicians, and the vascular surgeons, uh, they used to give some medicines for this, and proper stump care, dressing, and all the things, and refer for physiotherapy. Physiotherapy, they used to give stump exercises, bandaging, and proper stump training, because prior to that prosthetic fitting, they need all those things, because it is not such a easy thing that putting a processes and making them easily to walk. We need a proper stump exercises, appropriate training of the patient. But prior to that, this complication is a challenging one, phantom limb pain. So the part of a limb that we have to fool the brain. How we can do it? By means of two ways. I have been tried many patients. This was introduced by one of my colleague, vascular surgeon, who brought the patient to me and started insisting me to give TENS therapy and mirror therapy. So I have tried that such a patient, even the patient is in dressing and their medical care, surgical care. At that time itself, we have started this mirror therapy, just making the limb closed and making the normal limb and put a mirror opposite side, make them to move it for a morning, afternoon, and evening 3 times, like that. Automatically the patient feels that the limb is there, and automatically the pain of the phantom limb sensations will subside. I have already put a video on my channel. If you want, you can subscribe and go to that video and you can check that. So the phantom limb pain is usually can be cured by physiotherapy by means of this graded motor imagery technique and mirror therapy, as well as some sort of electrotherapy modalities can help short-term pain relief. So this is the important message I wanted to give in this World Disability Day as a physiotherapist. So the two disabilities, one is invisible disability, fibromyalgia, and another is visible disability, phantom limb pain for the amputee patients. So this is the two things I wanted to mention in this auspicious day. So we need to rehabilitate these two patients, make them to lead normal life. Thank you, one and all. Who are we? We are physiotherapists. Thank you.